When I meet a new patient, I have a standard phraseology that I like to use to comfort people because they're coming to a cancer center and they often don't have a malignancy. So I say, even though this is a cancer center, that doesn't mean you have a cancer. I take care of blood diseases. And I start most of my conversations that way for the first time because many people are very nervous. They may be coming to me because of a laboratory abnormality and not have a good understanding of why they're coming to a cancer center, as an example. So it becomes quite important to be able to calm people down for the first visit in particular. Another possibility is there are laboratory findings that can be serious or can be fairly mild and just a relatively routine thing. And part of my job is to sort those out and be able to pick out the ones that are more serious and the ones that are less serious. So I often say to patients, this is a common problem. Most of the time it's not malignant. And so that's another one of the phrases I often use with patients that I see. One of the things I've learned over the years is there's often more than one way to get to the right answer for treating a patient, and it depends a lot on individual factors. So you really do have to individualize care. That's important. And I'm also not that good at making an immediate decision. I like to think things through and mull them over. I think sometimes of putting a patient with a difficult hematologic problem together is like putting a puzzle together. And I'm much better putting a puzzle together when I have a little time to sit and think about it. And the way I've done that most recently is one of the few positive effects of COVID, and that is that I've been able to do telehealth meetings after my initial visit. So I will meet a patient, gather their history and exam, and as much information as I can, go through their records and laboratory tests that we do, and then sit and think about it. And then usually a week or two later, I'll go over what my findings and the potential plan with them and get their feedback and then go from there. I enjoy working with patients and I enjoy hearing their stories, their life beyond their medical history, because most people have very interesting backgrounds. And so the more time you have to spend with a patient and understand a little bit about their lives can be very, very rewarding for me in particular, that I have time to chat with people in that way. There are people with diseases called TTP, which is thrombotic thrombocytopenic purpura, which is a life-threatening disease that used to have a mortality of 90% within about a month, and now has a survival of over 90%. And so taking care of those patients has been quite gratifying for my career. I work with a team of professionals that are second to none. The nurses and nurse practitioners, as well as the laboratory staff and the medical assistants, are all exceptional at what they do. And I couldn't do what I do without those people working with me. So that's been a really important part of my practice and really one of the joys of working here at Siteman Cancer Center and the university, because there are really extraordinary people here to work with. Washington University is a gem in the middle of the United States with extraordinary medical care that is underappreciated by people on the coast. We're an area of expertise in many, many different fields. Another reason I really like working here is because any department or division that I turn to find expertise, I will find a leading expert in the country, if not the world, in that field.